Jambo, my name is Grace Kuto, born and raised in Chwele village in Western Kenya. With the support of my husband Paul Kuto, I'm the director of Chwele Community Development. The project is based in Kenya. I live here in Portland, Oregon. This work is mainly supported by, or I should say sponsored by, Target Community Friends Church in Portland, Oregon, and we've been doing this work since 1991. It is also supported by Harambee Center, a non-profit organization that I co-founded in 2001, and our mission is to connect people from the Pacific Northwest, part of United States, with the people and cultures of Africa.
And my name is Stellar Yi, and I'm a OSU OHSU PharmD candidate of 2014. I first was introduced to this project in 2012, or excuse me, 2002. It's 2012 now, and that was back when I was in high school. And I was first able to go to Chwele, Kenya with Grace and Paul in 2009, and that was when I was first exposed to the pharmacy setting in a third world country. And I was able to get inspiration and just fire driven in me to come back and go into pharmacy as a career field and bring back what I have learned and gained to Chwele this time around. And I was able to bring this idea out to other pharmacy students. It could be first year all the way to fourth year students. And we were able to bring a total of 6 or 5, I guess, right? It was about 5 students who were able to come. There was one CNA who was able to come with us as well. And we were going down to Chwele, Kenya to figure out what was best for them, what can be sustainable for their pharmacy workflow, so that we can create something that will last there, since we're going there to do a triage, which is something that's short term. And then when we educate them about a pharmacy workflow, that would be something that's sustainable and long term. So we were able to go to Lugulu Hospital and spend some time there to learn more about the Kenyan culture in terms of the healthcare setting, to bring that back to Chwele and implement that and educate the pharmacy workflow and staff members there at Chwele. And I also wanted to take some time to acknowledge and give thanks to those who have supported us. McKesson for our medical supplies, Walgreens for our medical supplies, and Dr. Gary DeLander, Ann Weber, and my preceptor at QFC Pharmacy, Elizabeth Lee, for all their help and support in helping us make this possible. And I forgot the biggest contributor, Grace Kuto, and her family, and Paul Kuto for being with us there, because they're the ones who really opened the doors for us to even do this. So I want to thank her and Harambee and everyone who was involved in helping her get this started, because it wouldn't be there if it wasn't for her and her woman power and courage and everything that comes along with that. So thank you, and hope you can see what we have done in the following clips ahead.
And I want to thank Stella for your inspiration. She's been one of our best volunteers. Our work happens because of the many volunteers in this country. Yeah, and I just also wanted to point out that our work spans several aspects of development. One is healthcare, the other one is education, and the other one is small businesses for women and their families. So again, thank you, and Stella will now present what they did on this trip. Yep. Summer of 2012.
Bye!
I'm expecting, well, actually, I really don't know what to expect because I've never been to Kenya, but I hope to learn a lot from the people there, and I hope that I can, help them in some way, and hope they feel like what we do is really important. And I know we're going to go there to help the pharmacy as well, so I really hope that we can make something that's going to last over there. I took the height, weight, right?
Yeah.
Okay, yeah, that's very good. Yeah, put it in. So you can do that. Because it has the full
So like the
cap.
mother.
We have to
Yeah.
use all three of these.
Exactly.
And
Yeah.
instead of saying free clinic, we're going to ask for 100 shillings
Yeah,
flat,
fully
and that's really cheap. Okay? And that's so that we don't have people coming here, and then by the time our supplies are running out, we don't have to turn them over.
Did you have the test strip for the blood?
And then the other money we're going to use to go and buy more medical supplies.
strips?
For yeah, exactly. So if you guys want to get, this bottom part.
Sure, I'll show you. I'll take you there.
I don't see them.
Yes. Nice. They've done good work.
Oh, I like that.
So we need more of that.
More of this? Yeah.
So-
More of this. We
More
can
of these?
distribute them, yes.
that's
Nice.
really
We
nice.
can do 2 more.
Yeah.
So you
What do
can
you want?
figure out which drugs
Capsules and tablets.
the clinic needs the
Oh.
most. And it looks like antibiotics is
suspension.
one. Antimalarials are actually pretty
And,
well covered here because it's one of the top.
And usually you gotta get the 500 milligrams.
Yeah, it's those kind of
Top
milligrams,
1 or
like
10
Latino,
diseases. That's
I'm excited to see what else baby clothes Stephanie brought. I think that was such a good idea.
such a good idea.
The date is 20.
We can find them.
Folates.
Yeah, which is the prenatal vitamin.
We have the
Yeah,
items.
yeah.
So you'll learn be giving that.
Okay.
So and then deworming. Do you have the dewormers?
The which one?
Deworming. Deworming. The mebendazole. The mebendazole. Babies breathe
Yeah.
by using this.
I see.
Yes, and then you can get it the gestation. That is the how old.
How old?
Is that? Because if I just calculating from the umbilicus, it's reaching. Yeah.
Injection
For
immunization. It's,
diphtheria, pertussis, tetanus, hepatitis B, and influenza. And we're questioning about
it's 3 times for the Hep B, but we weren't sure if you needed to actually get like 3 of the flu shot.
How is it? Why is this something that you guys would question?
we're getting unnecessary dosage.
So right now we have Kelly White in the storage pharmacy, the warehouse, and she is organizing it so that we can bring in more drugs once we purchase them here. So far we have anti-TBs. What else do we have?
It's all anti-TBs. These are all the suspensions, skincare, the rubbing alcohol and saline. Those are all the injectables.
Yes.
Rehydration salts, and then that way I'll have these 6 shells. So we went ahead and tried to stick with what they had, at least somewhat, just to keep it all from being confusing. So we have the ARVs up here. These are the patients that specifically have their own anti-TB med boxes. They come in every few weeks or however often they have to come in to get some doses. And then this is all the rest of the TB stuff for any new patients that come in. And then we have all the stuff that we brought down here, which is we have antacids, antidiarrheals, the antihistamines, allergy meds, and then we went just today and got a bunch of antibiotics because they were seriously lacking for them. We didn't have any. I think we had maybe 1 box of Cipro and that was it. So we went ahead and got that for them, and we have all the painkillers, vitamins, we got prenatal vitamins too, since they have a lot of antenatal care. And we also have gauze and all that stuff. And then another one.
They were so happy because when you treat them, you give them medication, which they have not been, because when they give them a prescription, they don't have money to buy the medication. So, they just go for consultation, but no follow-up, no medication because they can't afford.
Oh, Stella.
I have to put this in as blooper. It's 1 a.m.
Oh my gosh.
Could start all over. It's getting so late.
It is.
Hello,
it
camera.
is.
It's 1 a.m.
Yeah. Jumbo.
Okay.
Oh gosh.
We are just.
Yeah.
Okay.
If we put this off, honey, we are super women.